Now, epilepsy remains one of Kenya's most common neurological disorders, affecting an estimated 1 million people. Yet for thousands of families, the greatest battle is not only controlling the seizures, but also finding timely diagnosis, affordable treatment, and a health system close enough to support them. In Kajiado County, a specialized epilepsy clinic has been opened to bring care closer to the community. Our reporter Aaron Marie has the details of the new facility that is expected to improve healthcare for epileptic patients.
For many individuals living with epilepsy, every seizure tells a story of resilience, as the distances they have to travel in search of specialized affordable healthcare.
Mimi nimetoka Kiambu, sasa Rimuru, na before nipate usaidizi, the first hospital nilienda ilikuwa ni Kenyatta. Ukienda hospitali yote wanakuambia hawaezi.
Beyond this, they also have to battle with stigma.
Sometimes unatengwa kwa jamii, kama ni shuleni pia unatengwa, na pia ukikuwa mkubwa kama saa hii ukijaribu kutafuta kazi, kama mimi niko industry ya hair and beauty, unapata unaenda unauliza kazi mahali, but the moment maybe mwenye amekuandika analrealize uko na hii condition, ana feel maybe unaweza anguka na maybe umpotezee wateja wake.
Epilepsy can be caused with a lot of conditions, head injuries, obstruction of labor, a lot of things like those ones can cause epilepsy.
He wasn't born with it, but was diagnosed later after losing his father.
Vijana mnaambiwa wanaume haufai kulia. So I think sikupewa hiyo chance ya kumon, and eventually nika enter into a coma, and so from there walikuwa wanatibu nao hiyo coma, so si pelekwa kitu kama counseling ama ni, so eventually nikaanza kuanguka.
Many spend years relocating in search of proper treatment, while others abandon treatment altogether owing to cost or the misconception that epilepsy is caused by supernatural forces rather than a neurological disorder.
Watu wengi wana assume ni either ni kurogwa ama ni ile tu fainting ya kawaida tu, mtu aende hospitali na ndio aweze kufanyiwa the right diagnosis.
Epilepsy has silently affected entire households.
Niko na kijana wa sister wangu ambaye akona epilepsy. Akona epilepsy tangu kuzaliwa, akiwa mdogo akona hiyo ugonjwa ya kifafa. Kuna challenges sometimes, hajaenda shule, alikuwa ameanza shule kidogo mpaka class ya kwanza akakuja akaacha shule.
And Kenya has made significant stride in improving epilepsy care.
Previously there was a lot of stigma about epilepsy within the communities. There is illiteracy, there is no information that has been fed on the people.
Expanded awareness campaigns, increased availability of anti-seizure medication, and partnership between government and civil society have begun narrowing the treatment gap.
We've been doing primary health care training for the primary health care practitioners. We've also been training the community health promoters on how to identify persons with epilepsy within the community.
We try to make them so comfortable with the medication so that actually we capture them more so that they cannot have that hindrance of money.
But the greatest obstacle is ensuring patients remain on treatment.
Currently, the treatment gap in Kenya is at 80%. That means that only 20% of persons with epilepsy are being managed in health facility.
Health workers estimate that a large proportion of people diagnosed with epilepsy interrupt medication.
Worldwide, we have 50 million people having epilepsy, and in Kenya, we are talking about 1 in every 18 persons within a community.
And as part of effort of enhanced epilepsy care, a new clinic was launched in Kajiado County.
We are here because of 2 key milestones. One is the Stigma Bench, and the other one is the setup and the launch of the Affiliate Clinic at AIC.
When the community can stand up and understand this condition and reach out and help people with this condition, people will live better lives. So this initiative is so very important.
Health officials believe bringing services into communities is one of the most effective ways of enhancing adherence.
People are now changing their minds and accepting that it's just a disability, it's not a curse. People are now embracing and taking care of people living with epilepsy.
County health officials say the initiative complements ongoing efforts to strengthen primary health care and decentralize specialized medical services.
Kama serikali tutawapea support, tutakuwa pamoja na wao. Any support watahitaji, tutakuwa pamoja na wao.
For years, the Kenya Association for the Welfare of People with Epilepsy has remained at the forefront of epilepsy advocacy, supporting treatment, public education, caregiver empowerment, and campaigns aimed at ending discrimination.
If epilepsy is not treated in a proper way, you will find that it will come with complications. People assume that epilepsy is associated with madness and schizophrenia. This is just a complication on the type of epilepsy that has not been managed properly.
The initiative will expand access to affordable epilepsy services at the grassroots. For many families living with epilepsy, accessing healthcare has meant traveling for long distances. But with the establishment of this clinic here in Kajiado, that means easy diagnosis, treatment, and follow-up within the community. Reporting for KBC Channel 1, I'm Aaron Marie.